Okay, we'll start with the topic that is indirect inguinal hernia. Indirect inguinal hernia. This hernia travels down the canal. It travels down the canal, that is inguinal canal, on outer side of spermatic cord. On outer side of spermatic cord. Okay, this is a deep inguinal ring. This one is the inguinal canal, and this one is the superficial inguinal ring. What happens in indirect inguinal hernia? The content of the abdomen, that is abdominal content, may protrude from deep inguinal ring. They may go through the inguinal canal and they come out from the superficial inguinal ring. This is the indirect inguinal hernia, and as we all know, the content of inguinal canal is spermatic cord in males, so the content will remain inside or posterior to the to this hernia. So the indirect inguinal hernia is hernia that travels down the canal on outer side of spermatic cord. The spermatic cord will be on posterior side, and this inguinal hernia will be on the outer side of the spermatic cord. So this is the indirect inguinal hernia. This indirect inguinal hernia is commonest of all hernia. It is very common. It is common in young peoples. In the young ones it is very common, and it is bilateral in 30% of cases. So the indirect hernia is very common of all the hernias, and it is common in the youngs, and it is bilateral in 30% of cases. Now we will see the types of indirect inguinal hernia. There are three types of indirect inguinal hernia. First one is bubinosal. In bubinosal, what happens is only the content will remain only in inguinal canal. Content will be only in inguinal canal. Okay, this is deep inguinal ring, inguinal canal, and this one is the superficial inguinal ring. This is inguinal canal. So in bubinosal, the abdominal content will remain in inguinal canal only. They come out from the deep inguinal ring and they will remain in the inguinal canal only. They won't come out through the superficial inguinal ring. So once again I will explain what is bubinosal is. The abdominal content will protrude through the deep inguinal ring. This is deep inguinal ring. This one is the superficial inguinal ring. Superficial inguinal ring. So the abdominal content will protrude through the deep inguinal ring. They will remain in the inguinal canal only. This is inguinal canal. Inguinal canal. So the content will remain only in inguinal canal. They will remain only in inguinal canal. They won't come out through the deep inguinal ring. This is bubinosal. Okay, this is one of the type. The next one is funicular. Next type, second type is funicular. The content or the hernia will remain above the testes. Okay, this is inguinal canal, superficial inguinal ring, deep inguinal ring. There is pubic symphysis. This is inguinal ligament. Okay, so the content will come through the, or the hernia will protrude through the deep inguinal ring. It will come out from the superficial inguinal ring, and the content will remain above the testes. Below there will be testes. Okay, and this content will remain just above the testes. It won't go to the spermatic, in the scrotal region. Okay, this is funicular. That means it remains above the testes. And third one is complete. Third type is complete indirect inguinal hernia, and it will also called as scrotal. That means the hernial content will go into the scrotum, and the scrotal size will be increased. That inguinal hernia is called as complete indirect inguinal hernia or complete inguinal hernia. That is of scrotal type. So there are three types: bubinocele, which is the content will remain only in the inguinal canal, that is bubinocele. Next one is funicular, the content will remain above the testes. And complete, that means the content will or the hernia is in the scrotum, and because of that scrotal size will be increased. So these are the three types of indirect inguinal hernia. We will study the clinical features of indirect inguinal hernia. The male as to female ratio is 20:1. So it is more common in males than in females. The clinical features are: there will be pain in groin. There will be pain in groin, which is referred to testes while heavy work. Okay, so pain will be in groin region, and that is referred to the testes while doing the heavy work. The content or the hernia will bulge on cuffing. There will be bulging on cuffing. Okay, there will be bulging of the content on cuffing. So we have seen the etiological factors of all the hernias. They are almost common in all the types of hernias. One of the etiological factor for hernia is straining or cuffing. So while cuffing, it bulges out. It is one of the etiological factors, like cuffing will cause herniation. So there will be bulging on cuffing. It increases in size, and it becomes apparent on cuffing, and it persists until reduced. It persists until it is reduced. Okay, so the size of the hernia will increase, or it becomes more apparent on cuffing. Cuffing will causes bulging, and it persists until it is reduced manually. With the experience, patient himself can reduce that hernia manually. Okay, so while cuffing it bulges, and manual reduction, uh, you can reduce that hernia with manually. Okay, until it will persist until it is reduced manually. Okay, then as the time passes, hernia comes down even on standing. As time passes, or if it is long duration, then hernia will come down. Hernia comes down even on standing. Even on standing. So it is one of the clinical features of indirect inguinal hernia. Of long duration, the hernia will come down even after standing, and in some people it will comes down on standing, and it will reduce during sleeping time. Okay, in large hernias, in large hernia, there will be weight sensation. There will be dragging of mesentery, causes epigastric pain. Epigastric pain. Epigastric pain. Okay, so in large hernias there will be weight sensation. Patient can feel heavy weight sensation, and there will be dragging of mesentery, and it will cause epigastric pain also. So these are the clinical features. Once again I will repeat, in males it is very common. The male as to female ratio is 20:1, so it is more common in males. There is pain in groin region, which is referred to testes while doing the heavy work. During heavy work or during exercise, the pain will be referred from groin to the testes. There will be bulging of the content or the bulging of hernia on cuffing. The size will be increased, and it becomes more apparent on cuffing, and it persists until it is reduced manually. And as the time passes, the hernia comes down even on standing. Okay, even on a standing, patient will have the herniation. Content of abdomen may come out, that is herniation. In large hernias, there will be weight sensation. Okay, patient will feel weight sensation in the region, and there will be dragging of mesentery that will cause epigastric pain. So these are the clinical features, and also this indirect inguinal hernia may be found in infants. In infants, it is this hernia is may be found in infants, and there will be swelling when the child cries. Okay, on crying there will be swelling in the inguinal region. So it can be this indirect inguinal hernia may be found in infants. Okay, and in females there will be the ovaries may prolapse in hernial sac also. Okay, these are the clinical features of indirect inguinal hernia. Next point from indirect inguinal hernia is differential diagnosis. You have to differentiate this indirect inguinal hernia with, first is vaginal hydrocele, then encysted hydrocele of cord, encysted hydrocele of cord. Then you have to differentiate it from spermatocele, from femoral hernia, you have to differentiate it from incompletely descended testis, incompletely descended testis in inguinal canal. And lipoma of cord, lipoma of cord. So you have to differentiate this indirect inguinal hernia with this condition. Hydrocele is collection of serous fluid in the scrotum. So you have to differentiate it from hydrocele and the complete or scrotal inguinal hernia. This hydrocele is not reducible, it is not reducible manually, while the indirect inguinal hernia can be reduced manually. Then you have to differentiate it with femoral hernia, which lies just below the inguinal canal. Then when there is incompletely descended testis which lies in the inguinal canal, you have to differentiate it. If the testis is not present in the scrotum, then that can be diagnosed with the help of that point. Then if there is lipoma of the cord, you have to differentiate it with indirect inguinal hernia. So there are various points to differentiate between the hydrocele and indirect inguinal hernia. You have to do the investigations, and along with that investigations you have to differentiate with indirect inguinal hernia. Now we will see the treatment of indirect inguinal hernia. So the treatment is surgical treatment for indirect inguinal hernia. The surgery is dissecting out and opening the hernial sac. You have to dissecting out the and opening the hernial sac. You dissect and open the hernial sac. And you have to reduce the content. Reduce the contents of hernial sac. And then you have to transfix the neck of the sac. Transfixing the neck of sac. Okay, this is surgery. You have to dissect out and open the hernial sac, then reduce the content and transfix the neck of the hernial sac. Another treatment is herniectomy and repair. You have to do herniectomy and repair, that is herniorrhaphy. Herniorrhaphy. In this, you have to excise the hernial sac, excision of hernial sac. You have to do the excision of hernial sac, then a repair of stretched inguinal ring and transverse fascia. You have to do the repair of stretched internal inguinal ring and transverse fascia. And reinforcement of posterior abdominal wall is done. Reinforcement of posterior abdominal wall. So surgery is the treatment for indirect inguinal hernia. You have to dissect and open the hernial sac. Then you have to reduce the content and transfix the neck of the sac. And another treatment is herniectomy and the repair, that is called as herniorrhaphy. So this is all about the indirect inguinal hernia.